Good morning, everyone, and welcome back for part 4 with Dr. Choi. Today's topic is on maximize recovery of musculoskeletal pain with kinetic acupuncture, part 4. My name is Donna Chow, and I will be your host and your moderator for today's event. On behalf of eLotus, I'd like to welcome you and thank you for choosing Lotus Institute of Integrative Medicine as your CEU provider. We have been hosting educational courses for over 20 years, and we are proud to be your trusted source of continuing education. I'd also like to take this time to thank Evergreen Herbs as well as their customers. Because of you, we are able to host special promotional events and freebies throughout the year. When you choose Evergreen as your herb provider, you're also choosing to invest in the advancement of TCM. Thank you for being a part of a great collective. Helping each other creates a ripple effect with the end result of success. Before we begin, I would like to cover a few housekeeping topics. We are scheduled to end at 6 p.m. Pacific time today. Lunch is 1 to 2 p.m., and we'll have 2 breaks in the morning and 2 in the afternoon. Each are 15 minutes. Now, let me give you a quick overview of our webinar room. To the right of the video feed, you will find the PowerPoint for today's class. A copy of these slides can be found in a PDF version from the course access page. Under the video feed, you will find the chat room. And here in the chat room, you can connect with your colleagues who are also attending today's webinar live. For any side chatter, please feel free to private chat with your friend. And you can do this by clicking on the menu icon at the top right-hand corner of the chat room. If you have any questions regarding your account or technical issues, please send a private chat to the host. And then I or our tech, Sam, can take care of that. If you have a question for our speaker, Dr. Choi, please type it directly into the chat room so that he can see it while he is presenting. Please do keep your questions related to the topic that he is currently presenting, though. All right, let's get started with today's class on maximize recovery of musculoskeletal pain with kinetic acupuncture, part 4 with Dr. Choi. Dr. Choi is a top acupuncture clinician with over 24 years of experience, specializing in musculoskeletal pain disorders. Dr. Choi started his medical career in Seoul, Korea by earning a Bachelor of Arts degree in the School of Oriental Medicine from Kyunghee University in 1994 and a PhD in Complementary and Alternative Medicine from Cha University in 2008. He is the author of Orthopedic Tests Made Easy and also the co-author of Korean Constitutional Medicine written in Korean. So let's go ahead and give a big welcome to Dr. Choi. Dr. Choi, you are more than welcome to go ahead and take over.
Good morning, everybody. This is Dr. Choi. It is very nice to see you again. It's a Sunday morning. Today, maximize the recovery of musculoskeletal pain with kinetic acupuncture, part 4. Yesterday, we covered a lot of different issues which can happen upper extremity, like a wrist, elbow, shoulder, and even face. And we found out that acupuncture can be more effective combining just minor movement from just opening the mouth or grinning with the Bell's palsy, opening the mouth with TMJ, the complicated movement like oscillation, extension, abduction of the shoulder, gentle stretches on the elbow. If you do not want to give a mobilization or passive exercise with needles inside, you can just get rid of all the needles. And just you can apply those movement, passive movement, after the insertion, after the pulling out the needles. So I strongly encourage you to try this method, acupuncture, based on 5 principles, channels, and pattern diagnosis, and related muscles, related joint, and try to do appropriate movement. Oscillation to increase the blood supply, and stretching to tighten muscle, and strengthening weakened muscles. So basic concept is very simple. Try, and you can ask me anytime. I'm open to it through the eLotus.org. Before we start today's lecture with the low back and lower extremity, I would like to review the questions, the test questions yesterday.
I'm sorry, Dr. Choi?
Okay.
Dr. Choi, your volume is very low.
I'll adjust the volume. Okay, how do you like it? Still low? Testing, testing, 1, 2, 3. Testing, testing. Testing, testing. Is it better or just best? Is it okay?
I'll try and sound better now. Because when you're talking away from the mic earlier, the setting, your voice are not coming in strong enough. When you, right now, you raise it up, and then sound much better now.
Okay. I will try a little bit more. Sorry guys. I'm not a technical geek, but I'll try my best. I'm trying my best. Okay, yesterday that's what we learned. Combining the movement. Just simple movement can enhance your acupuncture effect great amount. Just try it. If you have a question, just contact me. I will try my best to help you. I want to let you guys apply kinetic acupuncture. Kinetic acupuncture is not something special. There are many versions of acupuncture combined with movement, like a 동기 acupuncture, motion style acupuncture. In China's 운동 친구요법, there are a bunch of different techniques, but I strongly recommend you try any of those acupuncture combined with movement. Okay, let me start with the test result yesterday. Okay. I gave you 10 questions. I thought those are essential questions regarding yesterday's class. And there was a question which was not described properly, so I will explain everything very quick, less than 5 minutes. Wrist pain on thumb side, which disease can I rule out? Correct answer is 4, because scaphoid fracture can happen around here. The pain can be presented here. The Quervain's disease, the pain can happen presented around here. A lot of the collateral ligament sprain, that means this ligament is torn, so pain area is around here. But TFCC, pain will be in the pinky side. So right answer is TFCC. And what acupuncture method is used for strengthening injured ligament? Using fire, using heat, or moxibustion. So that is 화침. So you can say this is heating acupuncture or fire acupuncture. So personally, I try to use the own terms. And to reach around the scaphoid bone, which point you apply in 관동침? 관동침 is a joint acupuncture. This is LI5. And number 4, which the point is not the point to treat muscles related to Quervain's disease? So this is the question asking you, this 2 muscle going back to the back of your forearm. So the muscle is around here. If you just flex and extend, you can feel the muscle belly is moving here. So it's not here. So this question is asking about you, which muscles and which point you treat for treating the Quervain's disease. So correct answer is LI10. LI10 is around here. So it has nothing to do with the Quervain's disease. So we need to treat this point as a 관동침, as a 근동침, muscle acupuncture. So which is the symptom of carpal tunnel syndrome? This question is wrong. There should be not. I'm sorry to confuse you. Which is not the symptoms of a carpal tunnel syndrome? Tingling, index finger, that is the right symptom. And pain on wrist can be a right symptom. In case they have a tendonitis here, they have a trouble in wrist movement, and the pain can be presented even while rest. And numbness of the pinky and shock-like sensation to the radiate to thumb is possible, but numbness on a pinky cannot be the sign of carpal tunnel syndrome, right? And this thing can happen with other nerves, not the median nerve. Maybe ulnar nerve entrainment, ulnar nerve syndrome, or upper C-spine disc herniation. That is not a carpal tunnel symptom of carpal tunnel syndrome, numbness on the pinky. The right answer is 3, as long as there is a knot. And which is the common tendon injury of baseball pitchers and the muscles to treat in 근동침 muscle acupuncture treatment? So first, medial epicondylitis, that is right, but wrist extensor, that is wrong, because pitcher's elbow is related to wrist flexor, not the extensor. Extensor is related to lateral epicondylitis. So this is wrong. Second, lateral epicondylitis, so it is not the right answer. Golfer's elbow or pitcher's elbow, that is right, and wrist flexor, that is also right. So this is the right combination, right answer. So answer is 3. And number 7, which point is used to control shoulder pain while applying movement? So this is the question asking you about disease-specific points. And there can be more disease-specific point. Here, this is my favorite point, 조구, 티아코, ST38, around ST38. The other point are specific point, other conditions like a Y-logon, neck pain, and taiyang, headache, intang for any other conditions. And which point is used to subside swelling in joints disease? And this point is the damp point of earth meridian. So it has a very strong characteristic of being damp, swollen. So when you reduce that point, you can subside the swelling. It helps the circulation of the spleen channel. So right answer is spleen 3. And number 9, which point combination is used spastic fingers after stroke? This is a question asking about this 2-point connection with 2 needles, Li3 and Li4, right under the bone. And what is not the one of the contraindications of kinetic acupuncture? Not the general contraindications. So the question is very ambiguous. So end of this contraindications, let's put it, of kinetic acupuncture. So active inflammatory regions, you'd better not apply the movement. You can aggravate the injury. So most of the kinetic acupuncture technique is not good for acute injury, except the technique we will learn today. The low back, the techniques for low back consist of traction and walking. Those are kind of safe, but other movement usually not recommended. And suspected bone fracture in same way, same reason. And completely fused joint, you can apply kinetic acupuncture, but there will be not much of a result because they are already fused, and there is a risk. And rehabilitation of hemiplegia, actually this is not a contraindication, but very good indication of kinetic acupuncture. So I wanted to share the last test questions, and there was a problematic questions, and these are the chapters I couldn't cover yesterday, and foot drop. So if I have enough time today, I will go back to the yesterday's lecture again. I will discuss about that too. Let's start today's CU. So in knee joint, we will learn the techniques which can be used: meniscus tear, ACL tear. I will not talk about PCL tear. PCL tear is not as common as ACL tear, and collateral ligament tear and patellar pain. Patellar pain can happen with many other conditions. So knee, wrist, ankle, they have very similar pathology because their anatomy and physiology and kinesiology are very similar. So they look very different, but their diseases are very similar. First, this is the structure. Second one, this is the structure surrounding the joint. And the wrist, we had two surrounding joints. When you sprain the ankle, you are spraining these two ligaments. Do you remember? Two ligaments on a side. Usually, when you fall down this way, this ligament is injured. The other way around, you tear this ligament. This is medial collateral ligament, and this is lateral collateral ligament. And you check integrity of this ligament by stretching it. And this ligament you are checking by stretching it. I hope you remember everything. Same manner. Here is ligament, the medial side, lateral side. This is exactly same way called medial collateral ligament and lateral collateral ligament. So wrist and knee share same name because it has the same structure. And what is in between two bones? This is femur and this is tibia. Radius, scaphoid bone, other carpal bones, ulna, radius. There is some structures, and between ulna and carpal bone, there was something like a disc, TFCC, triangular fibrocartilage. That is the meniscus. So meniscus, two meniscus are located left and right. So observing the shock and lubricating the joint movement. So number one, this blue area is a intra-auricular space. Auricular means joint, intra means inside. So inside the joint there is a cartilage. This is a cartilage, white one, and this is the meniscus cushion. And what else? What else do we have in this two space? Not like a wrist, there are two ligaments. That is ACL and PCL. Yeah, ACL, PCL, the location and function, maybe a little bit complicated to understand. Understanding that is good, but I do not think you have to understand that. Let's just think this way. That ligament inside is holding this tibia from coming forward or backward. No matter how it's shaped, no matter how the mechanical kinesiology applied, just there is a string, there is a chain or latch preventing the tibia is coming forward or backward. And these two ligaments in outside, they are there to prevent the tibia going left or right. So prevent swinging of the tibia. And number three region is the structures around this patella. So patella bone, above patella, there's quadriceps muscles. Quadriceps muscles, the muscles you can kneel while you can do massage while you are sitting. There's quadriceps muscles, and quadriceps muscle is connected all the way down to tibia. So three structures. First, inside of joint structures, intra-auricular structures, meniscus and ACL, PCL. And second, outside of the joint. Outside of the joint, left and right, collateral ligament, just like a wrist. And the moving part, muscles. Extensor muscles, flexor muscles. Same manner, this is the extensor muscle, quadriceps muscle, extensor. This is a knee, And this is your thigh, this is your shin, extensor. This is quadriceps, and flexor, hamstring. So we are understanding whole anatomy. I know you already know these things. Already, I think you're already familiar with these things, but I need to cover this fundamentals to process, talk about kinetic acupuncture. So knee intra-auricular structures, it looks complicated, but just think it is a ledge holding the shin coming forward from backward PCL, ACL, forward preventing, going forward. These are the intra-auricular structures. And extra-auricular structures, 2 ligament, and 3 tendons and patella, tendons and patella. First, let's start with meniscus tear. I told you meniscus is a cushion absorbing shock. The problem is meniscus have a blood supply at the margin, but they do not have enough blood supply to be healed inside. So even if it is a small scar, if the scar is located inside, it does not heal very well. But the scar injury outside can be healed because of the blood supply. Then what we should do is getting very clear. What should we do? We need to increase the blood supply around this meniscus. That's what we do. Next. And how do you know there is an injury in meniscus? Do you remember the stretch doll and compressing doll? This is the structure inside of the joint. So how do you test that? By stretching it or squeezing it? There is a structure inside of the joint you can check by squeezing it. So this is the compression test. Just simply compressing it. This is a compressing doll. Pressing and irritate. The McMurray test is just simple way of doing it. It is just way of compressing it. I recommend you watch that my CEU about physical therapies, orthopedic test. And I explained this McMurray test, the principles behind it, but here I will just skip. So that is the test of compressing. Do you remember how did you check the TFCC? Same manner. Squeeze, compress, and rub it. Compress and rub it is the basic way of checking all kind of infrastructure problems. So once you understand the basic principles behind all the orthopedic test is not something you should memorize. You can understand them. And to reach the meniscus, we try 관동침, joint acupuncture. This is the big joint between femur and tibia. You can insert the needle quite relatively deep until you reached meniscus. So more than 2 centimeters, so more than an inch. And use the relatively thick needle, 0.25 or 30. The basic rule of needle selection in kinetic acupuncture, first one is based on patient body build. If the patient is big, you'd better use a thicker needle. And second, muscle acupuncture, 근동침, relatively thicker needle to get the right T response. Joint, relatively finer, under 0.25. And if you want to give a strong stimulation, thicker needle. And if you want to tonify, not do any harm for righteous chi, use the finer needle. And those are basic principles of needle choice. So this is the case of Kwandong Chim. Oh, medial side meniscus tear, 3 weeks. So somebody has a problem with his meniscus. And do you remember how I told you about the rotator cuff tear? Textbook says sometimes you need to refer the patient. Likewise, 3 centimeter tear. That's a big tear, actually, a very big tear. But most of the cases are a couple of millimeters tear if you read the MRI. So I told you more than 90%. Without exception, personally, I could treat any of them without letting get surgery. And meniscus tear, most of the case, I think we can cure them with the acupuncture, with the proper exercise and acupuncture treatment. But it depends the location and the shape of the tear. If the shape of tear is a puncture tear, like a round shape, it is very hard to heal, even if its size is small. But linear one, even size is big, it can be healed faster. So it depends on the status of the tear. Yes, there was examination. Yes, there was examination. Okay, let me repeat this again. The 3 rules of needle selection. Three basic rules. First, body build, patient body build. Bigger guy, bigger needle. And second, thicker for muscle and finer for joint. 2, lessen the risk of hurting the nerves or other tissues. But muscle, if you locate the correct location, those are muscles, so no worries. And dry needling, they are using 4 times more thicker needle than us. So do not worry. If you are inserting the needle right on the muscle, 근동침, you can use relatively thicker needle. I personally, my favorite needle size is 0.35 and 0.40. So it is kind of thick. But joint, 0.25. That is my favorite. And what was the third? Third, when the patient have excessive condition, you want to reduce it, thicker needle. If your patient have a deficiency, and if you want to tonify them, finer needle. That is a very basic rule. Degeneration, knee degeneration, it will be there in following slide. So we will talk about the knee osteoarthritis. So this is Kwandong-chim is a very basic rule. Osteoarthritis, meniscus tear, ACL tear. This is the commonly used technique. It is not that difficult. Just let the patient flex their knees around 30 degrees, then the space is wide open. But 90 degrees is fine, or even straight is fine. You can insert the needle by controlling the tip of the needle. So it should change a little bit. But if let the patient flex their knee around 40 to 50 degrees, it'll be a lot easier. And LE 04, Xi'an, and ST35, both way. If the tear is in medial side, ST35 is mandatory. Thank you, Xi'an. Thank you, Dr. Zhou. And Kwandong-chim, this is the oscillation and tractions. So with the needles on this Xi'an and ST35, so you can see the needles. So one is green and one is silver, and giving oscillation. I will show you in a movie clip. And this is another way of giving oscillation and traction. I learned this from the physiotherapist. So usually let them sit down on a chair and simultaneously you oscillate the shin and also pull the shin downward and oscillation. You need a little bit of practice, maybe 5 minutes practice, you can do this. This is the general oscillation. I usually do this kind of oscillation. Same, in case here, I put the needles on the medial side, so as Xian. Let's see.
Why you can't visit our clinic?
Because my knee won't bend very much. Only a few fingers bend.
Okay, so your chief complaint is your knee is not bending, right?
Right.
So what happened?
You guys can hear, right?
Originally, from a massive poisoning about 6 years ago, like anthrax. And so it took over my whole body and I basically died. So I kind of kept bringing myself back. And what I did was I did some yoga positions while I was really ill and on fevers. And what I did was I bent my legs to see if I could stretch them, and my knee snapped in half.
Based I can put the needle is here, so based on the MRI scan, I decided to the point I.
It's one treatment.
One treatment with you.
Okay.
And it's been a big change already.
So what is the big changes?
More range of movement. I went to the gym and I could start working on the Stairmaster, which I've never done before in 6 years.
So just one treatment?
One treatment. I could also feel internally it actually moving backwards and forwards, which are inside. It was very painful the first couple of days, and then it let go and less pain. What else? I feel better.
Okay, how's it feel? What do you think about the treatment?
Oh, I think it's great.
So
because before we were only treating like my hands and my feet, we weren't going to the knee. But when other people did my knee with needles, it was too painful. I couldn't walk for two weeks.
Okay.
But when he did it, I can walk right away. So that
Actually, he did the surgery and patella and femur are all fused, and actually there is no space to needle is inserted deep inside. So it was really hard to put the needles around the knee joint, but I didn't go bother to put all the needles inside. But if it go inside, I just let it go. If it doesn't, I just do it with the movement. Did it with the movement. And there are many patients with knee surgery. And this is the 근동침. Actually, I usually here around 4 needles. And do you see the muscle is tightened here? His muscle is firing. So he's contracting the quadriceps muscles. I'm holding it down, giving isometric exercise. And most of the patients who suffered with chronic knee pain, they have a very weak quadriceps muscles. Muscle atrophy is very severe. So in most cases of knee joint pain, I apply this 근동침 technique. So with needles on a trigger point, muscle knots. Muscle knot means muscle quality is getting poorer. So it's like a smooth cloth, but middle of the cloth, if there is a kind of lump, or one of trace one out, then we need to straighten it out or rebuild it. That is the knot, and that is a not good quality muscle. So I'm releasing those knots and giving more sensation to our brain. This is isometric exercise. Muscle is tightened and you are resisting it. So with the needles in a 관동침 joint and with the needles on a muscle. Considering his problem, he has a very fine quadriceps muscle because he tried his best to keep his activity level.
I went to the gym and I could start working on the Stairmaster.
And this one is a just typical oscillation in a sitting posture. You can apply oscillation with a sitting posture or lying posture. It depends. You can see needles here, and also you will see needles here. See, the needles are shaking. That is pretty much everything about this case. Oh, did you hear what I'm saying? Could you hear me right now? Just 1 minute ago, 30 seconds ago? Okay, that's nice. And what would you suggest for, okay, why was your treatment different, doctor? It is a very strange question. My treatment is very similar to my colleagues, Korean acupuncturists who practice Korean acupuncture for musculoskeletal problems. Why my treatment, your treatment is different? DR? DR means doctors. Is that right? Then I can say my treatment is quite popular in Korea. Many acupuncturists in Korea practice this kind of technique, the oscillations. But I built theories behind it. Many of my colleagues doing the same technique, like oscillations and isometric exercise. It feels like they don't know why they are doing it. But I put all the fundamental theories for those techniques. That's what I did, and I named it kinetic acupuncture. So, but technique itself, I think it is 100 years. It go up to 16th century Hyung. Anyway, did you guys try to watch the Netflix? Try to watch that. Hyung, he's the most respectable acupuncturist. But the drama is a fiction, even though the drama is a fiction. Do you do leg flexion and extension with needles and a motor point quad? Yes, I do, but I'm not teaching that for this knee joint pain patient because I usually do those techniques for the hemiplegia patient and foot drop patient, not for the knee joint patient. But sometimes I do too. And Dr. Shin, he does that technique a lot. I think he is the most famous doctor in Korea, worldwide. And could you show the technique of leg oscillation part again? Sure. Actually, Dr. Shin, he made this kind of techniques popular all over the world. This is the oscillation. Okay. This is the isometric exercise.
Big change already.
So what is the big changes?
You can see muscle tightening
More
here.
range of movement. I went to the gym and I could start working on the Stairmaster, which I've never done before in 6 years.
So just one treatment?
One treatment. I could also feel internally...
Yeah, this is the oscillation. When you start first, holding ankle is easier. Or you can hold the foot. You can convey the rhythmical oscillation to the knee joint. But basic theory about oscillation is isolating only that joint. Please think about it. What if patients have a problem with the ankle? Oscillating with the ankle, it is not a good way. So basic rule number one is isolating the joint and giving oscillation. But giving oscillation, holding a shin is not that easy. So it's like giving a small oscillation, holding the end of the stick, but it is not easy holding in the middle. So I'm holding the ankle. So rhythmic, small amplitude. This way, small amplitude. And if you are asking about leg flexion and extension, full extension and leg extension will bother the patient with needles inside. So needle will bend and too strong sensation. That is the reason I'm applying isometry exercise. In this isometry exercise, you can see his muscle is tightening, firing. Needle does not change. Needle does not bend. But you can have a same result with isometry exercise. Even better result. Isometry exercise is a most of the better solution to stimulate the slow twitching fibers, which is important keeping the posture. I do not know about the surgery procedure he had because he didn't know it. Okay. Stop sharing. Osteoarthritis. Osteoarthritis is a very common condition, and the problem of osteoarthritis is they are running out of lubricating oil, and that is not a reversible process. Joint getting squeaky. So this is the osteoarthritis because there is no actual inflammation inside of the joint. They call this degenerative joint disease, referring to same condition. And this is the most common presentation from patient: stiffness, deformity, and early morning pain. Why early morning pain, osteoarthritis? Jumper's knee, when they try to move around, it hurts. But osteoarthritis, it is most painful when you start a movement, like a long time of sitting and try to stand up, it hurts. Because the lubricating oils are all gone, so it is squeaky when they start to move. So there is a stiffness, and that is the reason of making start pain. So start pain is one of the characteristics of osteoarthritis. Loss of mobility. This one. Symptoms are often worse when resuming. Here. When resuming activity. Color. Resuming activity. So with bad spells followed by a period of relative relief, muscle spasm and contraction in tendon. So this is the reason I apply 근동침 for osteoarthritis patient. And noise, less inflamed than other arthritic conditions. So there are actually no inflammatory pathology. So many people think this is not an inflammation, but it is just a degeneration. Progression of pain is usually gradual. So usually this kind of condition goes like this. It's getting severe. But there are periods of getting okay, and getting worse. So actually not this way. Sometimes it gets better, sometimes it gets worse, sometimes it gets better more. But eventually it goes up, so getting worse. So our treatment plan is not getting rid of all the symptoms of osteoarthritis. I tell my patient this way: come to me when you start feeling bad. Come to me when you start to have a aggravation, worsening of knee. And get the acupuncture about 4 times, 5 times, 2 or 3 weeks. Then you will get back to the point when it starts aggravated, not the stage when you are 20. I cannot make your knees just like a 20s when you're 20s or 30s, but I will make your knees before start of aggravation. This flare up, I will take care of that. That is my strategy. And people understand that too. So this is not a matter of treating, curing or not. This is a matter of helping their quality of life with the acupuncture. And how can you treat meniscus and ACL tear? By intra-joint structure acupuncture, 관동침, and oscillation traction is the tool. All three diseases, ACL, meniscus, osteoarthritis. I apply this 관동침. We need to lubricate the joint, meaning give more blood supply inside of the joint. And there are some research evidence about acupuncture and osteoarthritis of the knee. 1456 patient. Evidence that acupuncture is an effective treatment for pain and physical dysfunction associated with osteoarthritis. We can help them. For acupuncture point, so these points are most commonly used point in those studies. So we can assume that these points are more important point than other point. ST35, ST36, SP9, and GB34. 음능천, 양능천, 독비, 족삼리. And 7 other points, so we can say this is supplement point, were used, and these 2 studies were ST34, SP6, LI4, BL, BL line 60, 20, 23, and kidney line 3, 20, 23, 26, and SRAN, Xian. If you feel stuck in the middle of nowhere, you can try one of the points around here, but I'm telling you, point selection is not that important. How you insert the needle is more important. I need to tell this too. In the old days, if you read the classics, this point, ST35, is not the point inserting the needle deeper. So ancient book says less than 1000, maybe just 0.8 pun. That's because they cannot be sterile enough. They couldn't sanitize the device very well, so they might have experienced inflammation with the device. But these days, we can sanitize everything, and we can be sterile enough. So deep insertion is totally fine, and modern days acupuncture books teach the insertion into the joint cavity with the acupuncture needles. ACL. If the ACL is torn, so that is the ligament does, holding it, stabilizing it. So ligament injured, what happens? Pain and instability, the stabilizing device. So this is a drawer test. So I'm not explaining everything about this test here. Ligament and tendons. Ligament and tendons. Here is I want to discuss with you. What do you call this part? The white connective tissue between patella and tibia. What do you call this? Is it tendon or ligament? Interesting. Yeah. In old days, we call that ligament. But more of the books these days, they name this patella tibia tendon. And some book says this is the ligament, and this is the tendon, and this is the ligament. Some book describe that way because we usually think ligament connect the bones and bones. But either way is fine. That can be ligament, that can be tendon. But this is not a good example of a typical ligament. This is not functionally ligament. And the books these days usually refer that tendon, not the ligament. But nobody can say nobody's wrong about this. Because functionally, this is connected all together. This is one big tendon, and patella is just located in the middle of this tendon tissue. So if you see not this illustrated picture, but if you see the actually dissected human body, patella is inside, just inside a small part, and it is just whole connection from tendon to the tibia. So if you just Google it, the knee ligament and tendon, you will find more pictures explaining this as a tendon, not the ligament. Either way is fine. Yes, it is connected to contractile tissue. And this picture is kind of misleading. This is right. I will show you other pictures. It is more thicker than patella. So, and this connective tissue is encompassing patella. And functionally, even if it is not connected, actually it is connected to the contractile tissue. So you can call this ligament or tendon, either way is fine, but I'm saying is this is not the typical example of a ligament. So this is a typical ligament and this is the typical tendon. But I know there's some books explaining this as a ligament and this is the tendon, but it's very misleading about the function of the ligament and tendons. Nothing is wrong or right, but we need to understand the function of the part. And common modality, 관동침. 관동침. This is what I talk right now, and this is 근동침. ACL tear. I told you with the ACL tear, ligament tear, the most problematic condition is stabilizing. They lose the stabilizing ability. So just daily living, sometimes okay, not any problem, but when they try to get down, climb down the stairs, their knee feels unstable. Or they try to change the bulb on a ceiling and they need to step up on a chair, then they will feel the funny feeling, not stable, feel like it's stumbling over. That is the feeling of instability. That can be a sign of ACL tear or PCL tear. Then how can we compensate them? What if the tear does not recover 100%? That is what happening to the soccer players and martial art players. In those cases, we need to strengthen our quadriceps muscles, hamstring muscles, thigh muscles, because our hamstring and thigh, the quadriceps muscle, can compensate the function of ligament, ACL ligament. So we need to strengthen them. And this is why we should do 근동침 and home exercise for ACL tear patients. So strengthening of quadriceps femoris. And stretching the quadriceps femoris. And fossa, tensor fossa latae, stretching usually. Okay, Dr. Joe. That is a very difficult question. By any chance, are you a student of mine at the ULA? Anyway, one of my colleagues from Korea, he loved to stimulate the meniscus or other tissues inside of the knee joint. So when he inserted the needle inside of the knee joint, and he changed the needle tip and stimulate those cartilages and meniscus. So feel the sticky feeling. It's like a very hard jelly. Oh, no, not a rubbable. Very dense rubbable. So he intentionally stick a couple of times into that rubber-like structures. That is usually meniscus. But I do not do that. So it's a personal preference, and we didn't compare the result. Yeah, one of my colleagues from Korea do the same technique, but he tried to stimulate this inside the structures, but I don't do. And I do not think I need to do that, because you insert a needle, blood circulation shaped like a ball around the needle tip. I want to throw. So if you put the needles here, the blood circulation make like a ball. 3D ball. So around the needle tip, all area increase the blood flow. So if you pinch, surrounding area get red. Same manner. That thing happened inside of the joint. So even if you do not stimulate the meniscus itself, my hypothesis, they get more blood to be healed. So there is a difference. Good question. And we argue about that. Maybe I can try, but it hurts. So I don't want to make the patient painful. So this is a 근동침. So best point is to ST33 and SP10. If I need to pick 2 point, only 2 point treating knee joint, I wouldn't pick the joint point like ST35. I would choose these 2 point, ST33 and SP10.